if you notice, we've had one speaker from government, one speaker from private practice, one speaker from the university. This speaker is a person who is actually retired from clinical dentistry and yet stayed in dentistry. And our next speaker will be one that is in the public health clinic. But Ellie Phillips earned her degree in England, private practice in Switzerland, England, and USA. She earned her pediatric and AEGD from Eastman Dental Dispenser. Her topic today is the role of xylitol in oral health. She retired from dental office care, but she maintains 2 internet websites and blogs about preventive dental education. She's involved in development of xylitol products as well as associated xylitol education material. Dr. Phillips has published on xylitol. She informs me that early xylitol research was mainly from Finland, but NIH presented an evidence-based review in 2001. Xylitol works synergistically with fluoride, example water fluoridation, to offer enhanced caries prevention. I give you Ellie Phillips.
Thank you very much. Well, I probably should do a song and dance act to keep everybody, going. It's mid-afternoon, which I know is a tough time. So I'm going to try and keep things rolling along here. I have had a very interesting career. I did start out in England, the country known for the worst teeth in the world, probably. I grew up there in a time when people would actually threaten, if you were a child, you better behave or we'll take you to the dentist. And I wonder if some of that still holds true, we wonder why people don't like to go to the dentist. I hated going to the dentist, and in England certainly they treated children very poorly, and we had to sit there and have even extractions done sometimes without anesthetics. So I've seen the worst, equally bad in England, the caries rate, the early childhood caries, only we didn't give it that name. In fact, I deal now as, Tom introduced me, I call myself an internet dentist. It always gets people's attention and they think, wow, that's the kind I'd like to go to. So I then explain that it's not a money-making concern. I simply feel that people need help. There are people out there who have no insurance. There are people who cannot afford to go to the dentist. There are homebound people. There are mothers with multiple children, no insurance, don't know what to do. And they really have nowhere to turn for just good, practical advice. And I came across a life scenario of my own, which really gave me the training to do what I do now, which is answer emails. I make no charge for communicating by email with people. I usually answer about 10 to 15 to 20 emails a day. I go home at night and I spend about an hour every night answering these emails. I blog, and I have a website that's grown like a sort of random tree. I am just trimming it up now to replace it with a more organized website, hopefully to put on links to things like the maternal guidelines and so on. So anyone who would like me to link up with information as it goes along, the website will be called cleanwhiteteeth.com, and it should be launched in about 3 months' time. So I teach people a lot about xylitol, and I know it isn't talked about much in America, but it's been known in Europe. It was talked about when I was a dentist in Switzerland. A lot of the candy in Europe is made. It's called tooth-friendly candy, and every child knows that they simply have to finish every meal with a tooth-friendly food of some kind. In England, we usually finished a meal with a piece of cheese. Some places finish with celery. In Switzerland, they would eat tooth-friendly candy, which turned out later on to be xylitol, though I didn't know the name at the time. And I happened to marry a chef in America. We have a restaurant in Rochester called Phillips European Restaurant, and we're known for desserts and pastries. And I only tell you the story because as a dentist, I would come from Eastman and help out in the evening, and I would watch the staff snacking on cookies, drinking soda, eating breath mints. They used to buy the Altoid mints in the thing that was like 4 packets all joined together. You know, they were almost like a concertina thing. And I said to them, guys, why don't you eat xylitol? And there was a complete blank. Nobody had ever heard of xylitol. So I ordered some gum from Finland. I put it in a gumball machine at the back of the restaurant. Every waiter has a quarter in his pocket, so they would put a quarter in the machine, turn the handle, and get a handful of xylitol, gum for the back of the house, and mints for the front of the house. And they would eat this xylitol, and slowly over time they noticed that their teeth felt smoother and were becoming cleaner looking, and when anyone went to the dentist they were usually commended on their flossing. So they became very excited about it. And my name is Ellie, and xylitol, these little mints then became known as Zellies. So when you see that, I just want to tell you that's what happened. I never set out to get into the xylitol business. I was just trying to help my employees learn how to look after their teeth with xylitol. Xylitol is a natural sweetener. It's derived from birch trees in Finland. It was used during World War II for baking when they ran out of sugar. It's diabetic friendly, and afterwards, if anyone would like to come up, we actually have these packets in our restaurant in Rochester on the tables as a diabetic sugar alternative. It's delicious. I mean, absolutely delicious. It's been known, if I come across chiropractors or health people, holistic doctors fully understand xylitol. They've known about it for years. The local health food store in Rochester sells xylitol for baking and the individual packets. They sell chewing gum coated in it. So it's quite a well-known thing in the holistic world, just something that seems to have escaped American culture. Small amounts are produced every day by our bodies. People often get mixed up sorbitol, xylitol, and mannitol and maltitol. They are not all the same. The most important thing being that xylitol does not give you the gastric problems that sorbitol, mannitol, and the other sugar alcohols do. And I think a lot of dentists have discounted xylitol, imagining that you just can't eat it. I can assure you my staff eat it in quantity. They probably eat about 12 to 15 grams a day, most of them, because they're constantly snacking on the breath mints, and nobody has ever had a problem from it. Sorbitol, on the other hand, only 3 or 4 grams can really upset somebody's stomach. And people now are very tricked because there is chewing gum out there in the marketplace, and the outside of the box is happy to advertise now with xylitol. But if you turn over the packet, you will see the #1 ingredient is sorbitol. So don't be confused. Don't confuse your patients, because if they're eating this mixed sugar chewing gum, the chances are they're not getting enough. And we'll go through the dosage in a minute. It tastes exactly like sugar, maybe a little nicer, a little fruitier than sugar. And one of the things that's wonderful is that kids adore it. So to make a little solution, what I recommend to a lot of the mothers now, mothers who perhaps have babies that they are concerned about, early childhood caries, but they need a bottle. And that's one of my issues, that if you live in low-income housing and you have multiple children and you need a bottle, what should you put in it? Can anybody help? Because I need to give the kid a bottle. Give me some help. And I think I've always told parents, if you give cow's milk, you will probably be pretty safe. But I can now give them another alternative. So you put 1/4 teaspoon in a baby bottle. It'll be sweet, it'll be delicious, and the baby will be just fine, and the teeth will maybe even be protected. Little children, again, in a sippy cup, if they want something sweet, it is an alternative. And I think if you give people alternatives, they are mostly not stupid, not trying to harm their children, and you will see terrific results. So the xylitol has an effect on changing risk factors, in my opinion, as much as any other thing I can think of. We now know that there is remineralization of teeth. It's possible to make a tooth repair itself by putting minerals back into teeth. And it's also pretty well known now, and I'm very happy I've heard it over the last few years. It's been something I've been talking about for decades, that acidity is what we have to worry about, perhaps more than sugar. Everybody's been fixated that you mustn't eat candy, but they don't worry about the diet soda and the other things that are acidic. I had a server that came to work for us in the restaurant, wanted the late night shift because she needed money to pay for the crowns. She had just had 3 root canals and 3 crowns, and the dentist was basically working around her mouth. I don't believe that these things happen randomly. I always believe that we can track back to acidity or dry mouth. So I started interrogating this girl. Now, what do you drink? What is the acidity of what you drink? Do you have a dry mouth? Do you have acid reflux? What's the acidity of your own saliva? All these questions. And every single one, we couldn't find out what it was. So she worked her shift. And at the end of the night, I told her, here, you sit down there. I'm going to get a glass of wine. I'll sit down here, and we'll go through everything that you do during the day. Here was a girl who was a health food person. She lived a healthy life. She flossed. She brushed. She did everything. But first thing in the morning, she would get out of bed and she would get a lemon and she would slice it in multiple pieces. And she would suck the lemon before and after every meal. She was from Turkey. And it is a Turkish tradition to cleanse the palate with a slice of lemon before and after the meal. So she was finishing every time she ate or drank, she was finishing that with a lemon juice in her mouth. We simply put her on xylitol following the lemon juice, since xylitol takes away mouth acidity. And she hasn't had any more treatment since. So she would be a stand-up endorsement for xylitol. Xylitol also reduces this problem that we've talked about all day of mothers transmitting bacteria from their mouths to their children. The greatest thing about xylitol, and what you need is a minimum amount. If you eat less than 3 grams of xylitol, you will not see this suppression in this bacterial count. So if you're eating Orbit chewing gum, you can actually be non-effective at all, and the sorbitol element that's in the chewing gum actually has been shown in the 3rd piece of gum. The bacteria of your mouth get used to sorbitol and start to grow and thicken. Now, I worry a lot about kids that alternate sugar and sorbitol, and lots of teenagers do that. They drink sugar drinks and then they eat sorbitol chewing gum. And I think I've seen the worst gingivitis in those cases, and often accompanied by acid reflux symptoms, which I believe may well be the bacteria in the esophagus producing acids in the same way that the plaque bacteria on teeth produce acids that destroy teeth. I don't know whether that has been investigated, but it wouldn't be too surprising to me. So xylitol helps by contracting stopping the contraction of infection from person to person by reducing the strep mutans count in the mouth. It helps tip the remineralization balance in the mouth because it actually stimulates alkaline saliva in the mouth, even for patients who have no salivary glands. So for your Sjogren's patients, this is an amazing product. For people undergoing radiation treatment or chemotherapy, this is an amazing product. They could make it into a solution and rinse it around their mouth if they don't want to actually ingest it. They can have chewing gum flavored in the multiple flavors from health food stores. There are breath mints in a variety of flavors. There's even Floss and Wipe, which is a towelette impregnated with xylitol, 100% xylitol, that has a length of floss attached if you had a debilitated patient or you were traveling. There are so many ways now to find xylitol. I view it as a tooth protective food. The minute I tell people how safe it is and how it's a diabetic sugar alternative, the next thing they want to go out and put 4 pounds of xylitol in everything they bake. I'm not sure about that. I am not going to put an endorsement on eating a pound of xylitol a day. I do believe you need some for dental health, particularly in a high risk, if you're high risk for caries. But I don't believe you need more than 2 or 3 teaspoons a day. You can bake with it. If you had a special needs child, the only way you could get them to eat it would be to make it into a custard or into some sort of food, better than none at all, because it will have the plaque reduction. Peter Milgram in Washington actually did a study to show that if you're trying to suppress the strep mutans, it doesn't matter how. It can be in any shape or form, baked into goods, made into anything. It will still suppress the bacteria. If you're trying to, at the end of a meal, stimulate alkaline saliva for remineralization, you need to eat it at the very last thing, after your soda, after your meal, after your lemon square, or whatever you're going to suck that's acidic. So if you see patients with rampant caries or tooth decay, or even in later life, quiz them, question them. I spent years and years and years. Nobody taught me that acidity was a problem at dental school. They showed Stephan's graph that when you eat sugar, the mouth becomes acidic. But nobody explained to me that maybe the mouth would be acidic because of these other reasons. Dry mouth, if you have no saliva to produce a remineralization of teeth, your teeth are simply going to be attacked without the balancing remineralization. And we have now discovered that every first stage of a cavity is simply when the demineralization is not sufficiently balanced by remineralization. So if you're damaging your teeth more than you're repairing them, you will end up with a cavity. And xylitol simply helps to tip the balance in the right direction. If you have somebody with acid reflux, stomach acids can dissolve teeth. Little half grams, little breath mints that are half a gram of xylitol constantly throughout the day. Same thing for people with dry mouth. Those that travel around with me know I've always got some xylitol in my pocket and my purse, and I have no plaque, I have no strep mutans count. I actually took a salivary test not long ago, and they were undetectable limits. So I'm happy about it. Remineralization occurs, as we just talked about. Fluoride, of course, acts as a catalyst to speed remineralization of teeth. I love the concept of using xylitol and fluoride together. Fluoride has a really good protective effect on the outer shell of the enamel, the outside skin, as I tell people. I often to patients explain if you use the two together, you get a kind of healing similar to a wound in your skin. Xylitol kind of heals the deeper layers. Xylitol works on the flesh part of a wound, whereas fluoride works on the superficial part, the skin part of the wound. Use these two together and you will really see an amazing benefit. You can even see cavities reverse. Now, I don't have all the statistics to talk about that at length, but in our restaurant, once again, I have a wonderful story of somebody who had, his son had 4 occlusal molars that required fillings. He could not go back. Said, what can I do for the 6 months I cannot go back? We got him the fluoride mouth rinse that's in the stores called ACT. It's the dilute 0.05 sodium fluoride rinse in conjunction with xylitol at 6.5 grams every day. He went back in 6 months, didn't say anything. The dentist picked up the Explorer, checked the teeth, and was convinced he'd already done sealants on them. He actually wanted to charge him for the sealants that he'd done. So you can get reversal. And this is what I try to help people on the internet do. If they are without treatment, if they cannot get to a dentist, combine these healing elements together. These are the trees from which xylitol was first taken and made. 100 years ago, it was used as an IV source for diabetics undergoing surgery. Native Americans seem to know about this because there are many reports of Native Americans biting into the wood of birch trees. If you go to Letchworth Park ever, you could ask the guide, because we did this. We took a horse trail, and the guide was telling us all about the trees. And my husband said, go on, ask him about birch trees. And he knew. He said, if you've got bad breath, you cut this little matchstick out of the tree, and you can use it as a toothpick. And the GUM brand actually does sell a stimulant-type interproximal cleaning stick made from birchwood, which would be very good. It raises the mouth pH. I don't know how many of you take patients' pH of their mouths. I think it's very interesting, and I wish more was done. I have taken a lot of pH testing of my 70 employees in the restaurant, and we discovered, I mean, again, it's not the science that I wish it was, but we have discovered that men appear to have alkaline saliva far more often than women. Women seem to be much more variable, and the slightest amount of stress seems to turn women's saliva to become acidic very rapidly. If I were to get my pH testing paper right now and test my saliva, the chances are it would be acidic because I am presenting to you and have had a busy day, and simple little things like that are enough for women's saliva to become acidic. The older and grouchier we become, the more acidic our saliva becomes. And the first thing that most women find in their 30s and 40s is they get a groove at the gum line where they've lost a whole piece, a whole chunk of the side of their teeth. And this, to me, is usually the first sign of acidity in the mouth. And I get patients to start eating xylitol and using fluoride in some way, shape, or form. Back now to this very important factor that we're here for today. I've talked a lot about this transmission from the mother to the child. When the parents are infected with cavity-forming bacteria, they will then most likely infect the children or a child. And I absolutely agree that you get these whole families where it's not equal. However, you have to ask a lot of questions to find out what's going on. Was the older child cared for by grandma? Was the older child in daycare? There is horizontal transmission just as much as there is vertical transmission. The other thing we find out that is sort of easier to understand now than perhaps years ago. Years ago, we used to give antibiotics, and people wiped out all the bacteria in their intestine. The next thing they found, they weren't absorbing vitamins properly, they had overgrowth of yeast, and often contracted worse infections. Intruder bacteria can get in when your system is not protected. And one of the things that xylitol is really cool because it basically works as a probiotic. Anyone here know what probiotics are? They are things that basically encourage the growth of healthy protective bacteria. There is no way to have your mouth completely sterile from a bacterial standpoint. It is the orifice for our entire intestine. And we already know that you need probiotics to have healthy flora in your intestine. It would make perfect sense that our mouth is in the same predicament. The problem with most people's mouths is that at some point they became infected with unhealthy bacteria. So what xylitol does is it helps to change the flora of the mouth. It helps to get rid of unhealthy bacteria and grow healthy replacements to protect your teeth. Now, how it does this is interesting because it's just like sugar. When you feed the acid-producing plaque bacteria in your mouth sugar, they absorb the sugar and metabolize it to produce more bacteria and acids, right? Everybody's familiar with the acid production of plaque bacteria. When you give them xylitol as a dietary change, they absorb the xylitol, but they cannot process it, and in actual fact it binds their proteins. So they can no longer produce acids. You cut off the acid production immediately. So if you've got somebody with gross plaque and they eat xylitol enough, immediately they are going to cut off their acid production in the mouth, which is going to help. They're going to stimulate alkaline saliva. These acid-loving bacteria are going to hate that mouth. The other thing that's going to happen is that dangerous plaque, our plaque that produces acids, also produces those sticky tendrils that glue the plaque onto teeth. Interestingly, when you feed strep mutans xylitol, not only do they no longer produce acids, but they no longer produce their sticky tendrils. I tell patients that the bad bacteria, kind of like spiders that get stuck or you know, those lizards that stick to the wall in Florida there. They stick onto your teeth. When you give these plaque bacteria xylitol, they no longer stick to teeth. So they are much easier to brush or floss away. So the impact can be enormous. We've talked about all of this today. The one thing I think very missing that I would like to tell as many people as possible, the toothbrush. We got gloves, yes. We get all these things to isolate us from bacteria. But every day your patient with that gross bacteria-laden mouth puts their toothbrush in their mouth and then pulls it out and parks it next to somebody else, most likely their children. Or they leave it on the counter. Or it's roaming around the bathroom. Especially if you're my children at college, you know, I have a heart attack because they all share the same bathroom that's filthy. Toothbrush bacteria pick up bacteria. They grow on toothbrushes. The molds that anyone who cleans the shower knows grows in the shower every week. For some reason, it just arrives there, grows on toothbrushes. I teach people to clean their toothbrushes avidly every day, especially if they have gum disease of any kind or if their children have caries. We have to look into all these little things that are happening that maybe transfer the bacteria. If a child has a course of antibiotics, you are denuding the teeth. Did the one sibling possibly have ear infection given antibiotics and then picked up by some stay that they had with grandma or in the hospital, the different flora in the mouth? Very hard to go back and see, but the good news is with xylitol it doesn't really matter what happened before. We can start today and go forward and get rid of the old bacteria that we don't want and grow the healthy new ones. But we must realize that around us are people with bad bacteria. If you travel in I'm phobic. I mean, my kids will not take a toothbrush back out of a hotel room in case it was in the air. So, you know, be a little concerned about toothbrushes. And Listerine is absolutely great for cleaning toothbrushes. You can just swizzle it in some Listerine, run it under the running water, and then dry it, air dry it every day. When people keep toothbrushes in bags, they are just a culture medium. I know that New York State enacted a new toothbrushing thing some while ago in schools. Have we done any look at those toothbrushes from a bacterial standpoint? Because I would love to, because perhaps that's a breeding ground. And in Scandinavia, most preschools in Scandinavia, instead of using toothbrushes, actually give the children xylitol chewing gum 4 or 5 times a day through the day and have the children chew it, spit it in the garbage. They don't have to keep it in their mouth any longer than just to get the sugar, the xylitol, out of the chewing gum. This is the sharing of bacteria within families. We know that happens. Lowering the count, and the importance of lowering it, as we know, before molar teeth erupt. We know that if a child is infected with harmful strep mutans before the age of 2, they are more likely to have caries for the rest of their lives, or more caries at 4, and then we know that if they have it at 4, they have more risk in the future. It is a progressive, destructive disease. This makes sense. It also makes sense that if we can change the flora of the mouth before the molars erupt, because the first bacteria in the molar grooves win the game, basically. I believe that there is research, plenty of research to show that the main bacteria flora of the mouth is represented in the grooves of molar teeth, which is exactly why we decided to seal them. Let's get rid of them. But the question that I was sort of asking earlier today is, we may have sealed the grooves, but we still have the bacteria in these mouths to reimplant in the next teeth that come through with grooves, which are usually premolars. So there are these special moments when if we could change the flora of the mouth, we could change the child's life forever, potentially. It takes 6 months of 6.5 grams or more a day to get rid and turn around the flora of a diseased mouth. In the first 5 weeks, you get rid of the plaque on the teeth, and then you get rid of the plaque that is elsewhere, in the eustachian tubes, the back of the throat, in the saliva, in the surface of the tongue. Again, we have to think, as Dr. Billings said earlier, we don't think of teeth as these little pearly bubbles in our mouths. It is part of a whole oropharynx. And when you do that from a bacterial standpoint, you realize that you do need to change the bacteria completely around. Interestingly, I go back to the restaurant, which has been an enormous success because not a single of the 70 employees has had a single sick day in the last 10 years. They've been eating xylitol. No sore throats. And we interact with the public all the time. Are they just incredibly healthy because of the chocolate I feed them? I don't know. But it's certainly interesting and something I think we could get into. So affecting the mouth flora prior to the molar eruption is called a window of opportunity. And if you know eruption times, you will know that the windows of opportunity are really this: when the mother is pregnant before the child grows the first tooth at 6 months of age. Because we just said it takes 6 months. So even if during pregnancy you cannot persuade this mother-to-be to eat anything that has a weird name like xylitol, even though they'll drink diet soda, which I wouldn't I mean, that's the most amazing thing to me. But if you cannot persuade somebody to do something different, you could persuade her to at least rinse her mouth. And then once the baby's born, perhaps they will become more familiar with it and eat and chew the gum that contains xylitol. And in 6 months, you have enough time to completely change the flora of the parent's mouth prior to the eruption of the first tooth of the child. There is also a company called Spiffy's that makes a baby tooth wipe that can be wiped in the baby's mouth before the tooth erupts, again, to make sure that there is no wandering harmful strep mutans wandering around prior to the eruption of the first tooth. Because obviously once the first tooth is erupted, it will become infected with the bacteria in the mouth, and that tooth goes on then to infect all the others. So you have the first 6 months before the child has a tooth, before the eruption of the deciduous molar teeth at 18 months to 2 years, and you have a last-ditch attempt at 4 or 5 years of age, before the eruption of the permanent molars. And this is an amazing thing for a pediatric dentist to be able to explain. The dosage we've talked about, less than 3 grams won't work. Splitting it up in multiple doses is ideal, which is why I'm such a fan of the breath mints and chewing gum. Or for young children, making a solution, because you do have to dissolve it in warm water to make it dissolve, but then putting that water maybe in the refrigerator and having them have it through the day, several times through the day at the end of meals. And it is perfectly safe to eat the entire jar, as my son, of course, did, but no ill effects. Now, they've done this in Europe, they've done this in Scandinavia. I was waiting to see why we didn't do more of this xylitol strep mutans reduction in America. And I'm pretty impatient, as anyone who knows me knows. I cannot wait around. It's agony sitting down. I'm a mover around a person. And I was waiting, why didn't we start using this in America? And in 2001, I went to the NIH, had a symposium in Bethesda. And it was on caries management. And they did the first of the evidence-based reviews of research. I'd never heard about evidence-based reviews until then. They explained that in order for something to be statistically significant, too many people were doing studies and fiddling around with the numbers and losing results and putting a wrong bias. And so they would take the studies, they would get proper scientists who really understood it to read the studies, to grade them, kind of in the way your high school teacher used to grade your English paper and give them a grade of 1 to, I don't know, is it 8 or 9 or 10 or something? And then they added up all the numbers and fed the statistics through the proper current modern standards. And the result was, how do these studies hold up under evidence-based review? And I was fascinated. I'm sitting in the audience there with my xylitol friends, people who also believe in xylitol. And Catherine Hayes from Harvard, an epidemiologist from Harvard, presented the studies and explained that, yes, the results are statistically significant, that xylitol does reduce the strep mutans count. So we all high-five and we're all excited and we're waiting. Okay, now it's going to come. Remember, this is the beginning of 2001. And some of you in the audience today here in this dental world have never heard of xylitol. Where did it go? And I cannot answer that question. The US military, who is sitting behind me, immediately enacted the use of xylitol. And they have used xylitol in every MRE, the meal ready to eat, that they use for the troops out in Iraq. In every meal pack, they have 100% xylitol chewing gum to help the troops maintain dental health, because of course having caries on the battlefield would be terribly difficult for them. And we've done this. This is the history. Dental benefits actually were, the studies with mothers were done in the 70s in Belize. They actually gave the mothers this chewing gum and then followed the progress. They left the country, took the chewing gum away. They had given these mothers from the last trimester through a year, 10 grams of xylitol a day, and then they went away, took all the xylitol from them, and then went back each year to check on the children of the mothers who had chewed xylitol. Okay, follow me? The children had nothing done, just the mothers had chewed the gum. And at 6 years old, they found the children to have 80% less caries than the control groups. Unfortunately, because this study was done outside of America and by Finnish researchers, it doesn't gain a lot of credibility, although it was one of the studies, I believe, that was carefully looked at, and good studies. And in my book, if I was pregnant and had caries, I would certainly be interested to know about this. Lots and lots about it, and basically it just reduces the number of strep mutans. Within 3 months, it's significant. These are pictures of somebody who chewed 3 times a day a couple of grams of xylitol. No other changes in oral care. You can do this study. Kids do these studies at school. We did a strep mutans count in the restaurant. I mean, there are many ways to do this. And until somebody speaks out more about xylitol, I decided that that would be my task. Because I just think it's too good to leave alone and not use it. And here are studies actually that show how there was less caries at the end of the studies. In other words, the incipient caries had gone away, had remineralized. And, you know, I think it should all be part of programs, of education, but I think for mothers with small children, with this early childhood caries that's so out of control, with the need for substitutes for sugar in this world of all these awful artificial substitutes that everybody's now believing is healthy and safe, I think that we need to talk more about xylitol. This is from the Catherine Hayes. This is the conclusion of that 2001, that it would be unethical to deprive subjects of its potential benefits. These are products. There's the Spiffy's dental wipes for babies. They've done some research quite recently, I believe, in a study. This is the granular sugar that you can probably find in health food stores or certainly online. This is a product from China. There's a big vitamin company in America that sells xylitol as well, and you eat, you know, Strive for 5. It's the same kind of thing. And if you can get this going before the eruption of the molars in children's teeth. Parents have so much more control. This is something for people who have a long-term history of family poor dental health. Those genetic factors, perhaps, that up until now they've blamed because they have maybe incomplete lip closure, or maybe they have division 1 malocclusions where their front teeth get really dry. I mean, here are so many applications. And when mothers and children, this whole thing happens together, you would get the maximum benefit. So, you know, I think xylitol offers us tremendous help with the strep mutans. It also, and there isn't any evidence-based research combining all the studies yet, but there certainly are studies to show, and you can do your own tests if you get pH testing paper to show how xylitol tips the mouth acidity to alkaline within seconds. And if you know that acidity demineralizes teeth and that alkaline mouths remineralize, there would be no reason not to believe that you cannot remineralize teeth by constantly eating xylitol. When I give seminars, I often put an egg into vinegar or diet soda or something. Vinegar is good because it stays white, and then I can just drop it into soda or coffee and show how the soft eggshell stains because the acidity has eroded the shell of the egg. You can literally brush it off with a toothbrush, and that's what happens to these people who drink diet soda and then go brush their teeth. People with dry mouth, great risk. People with acidic mouths because of sickness, chemotherapy. Every pregnant woman has an acidic mouth. My daughter-in-law, the day she was pregnant, had to call and tell me that she had an acidic mouth. Maybe she was pregnant, and she was. I mean, it was almost instant. And the third trimester, every pregnant woman has an acidic mouth in which these acid-producing, aggressive, sticky bacteria grow, damage teeth, form plaque deposits in layers that irritate the gingival tissues. And here is xylitol to help. It has a low glycemic index of 7. It's low calorie, 0 carbs for you on the South Beach diet. And if you're an athlete, you'll love it because it helps preserve muscle and get rid of fat. So for long-distance runners, it would be a very good safety for them. So I have a daughter who's an Ironman, and they eat these awful carbohydrate things, and they drink the Gatorade, and I cannot imagine what her teeth would be like without this extra protection. So all sorts of good things from that. It is also useful, it has been used, and there is research, and you can probably find on the internet, or I can certainly give you, I do have handouts if you're interested at the end with these things on it. The nasal wash. I mean, if you have allergies or a sinus that just hasn't been responding, or you have, you're unable to take the medication for whatever reason, this is just xylitol in a saline solution, found to be extremely effective for clearing nasal congestion too. And we know that children, the other thing, it has an effect on the bacteria in the eustachian tubes, with the result that xylitol has been shown to reduce children's ear infections by 42%, middle ear infections. Actually, that was the first way they discovered the use of xylitol, that xylitol was having this effect, was at the end of World War II, the children eating a little bit of xylitol each day were not getting as many ear infections. And it was sort of then the dentist picked up, and the thing spanned from there. So we know that children with chronic ear infections also miss school, have acid reflux often in conjunction. Isn't that interesting? And that xylitol can help not only with the acid reflux, but their ear infections and the teeth, which is often, they show this erosion of their teeth from the acid reflux from the, you know, which is the cart and which is the horse. I think it's all connected with infected bacteria. We've been there, and we've been here already today. This is the ear infections. For debilitated patients, I had a very good friend who unfortunately at a very young age had a stroke. The minute they put the feeding tube in and he's lying there, you know the next thing he's going to die of pneumonia. And sure enough, that's what did happen. And I was beside myself because I wanted so much to be able to use xylitol and see if perhaps it could have had an effect in protecting. I don't know, and because I wasn't family, and this was some years ago before xylitol was much talked about, I didn't go down that road, but there is research to show that it may have an effect on other bacteria that perhaps grow and flourish in the mouth. So spritzing the mouth of a debilitated patient or a special needs patient, they make a thing called Xylimelt, which is a xylitol lozenge that has an adhesive backing. You can stick it then on a denture or on a feeding tube. Xylitol is also antifungal. So if patients are getting angular cheilitis or denture stomatitis, it's another great use. It's not going to do them any harm, and it's, I mean, you can get mouth sprays with xylitol for elderly people. I'm giving a talk next week in an assisted living center. I go from holistic mom groups to assisted living centers to wherever I can because this has so much application. So thank you for listening. Anything, there's probably a lot of questions. I'm happy I didn't bring a lot, but if anyone is really interested in pH testing, I would highly recommend it as a useful way to determine what's going on in your own mouth, so that you can see which foods are acidic and which foods are alkaline and how you can, it's very, my pH, when I'm on the beach in Florida, no kids, no stress, no nothing, will be alkaline. As I pack my suitcase, my saliva is acidic. My husband, always alkaline, except for the day, you know, when the cat died and the kids are there, and I mean, real dramatic loss of a spouse, stress, things like that appear to change men. And I say appear because I haven't got the time to do research. That's for everybody else here. But in my observation is that it takes a lot more for men's saliva to change acidity. And I think when they first started doing pH testing, most dental students were the subject matter and most dental students were men. And it wasn't very exciting. But I think if they took women, they would see a lot more change. So anyway, I hope I've explained something, at least opened your eyes to xylitol. Yes, sir?
With the remineralization of the enamel, what happens with the dentin? Does that remineralize, or are you trapping dentin that's there?
Well, I think it's very antibacterial. And you know in the old days when you saw the fluoride had worked and you got the closure of sort of the skin on the outside of the, you know, the outer enamel, but then you'd go in and then it would be a nightmare underneath. It appears that if you combine xylitol, and again, I don't have research for this, but it would be fascinating to do because it certainly works deeper layers. And you do seem to get complete repair. And I assume that the antibacterial, along with the remineralization of deeper layers, and then the closure with the fluoride on the top, is beautiful. Any other questions? Does anyone, how many people here eat 100% xylitol or know about it? Great. And how many people here was the first time they ever heard of it? There's such a disconnect, and I don't know why that is. I mean, we're going to change it, and anything I can do to help you. I come to dental offices if you're in a dental office, and I'll bring some Phillips cakes with me too. So. Yeah. Where do you get it?
Yeah, repeat the question. So that
did you say where do you get it? Well, Wegmans sells now the mints and the gum. If you have a health food store, they probably sell some gum. They probably sell granular. On the internet, you have the whole slew, the baby tooth wipes, If you have any trouble, email me. I'm very easy to email. You know, where do I get? I'm not product specific. I am a xylitol advocate. So whatever you're looking for, I'll help you find it. Sure.
These mics are okay, so you don't.
Does it have the nasal spray as well?
Stay
That's
here.
great. That's great. Ellie, E-L-L-I-E, at cleanwhiteteeth.com or Zellies.com, either one. And if anyone would like a book that I wrote, I am humble. I don't have all the qualifications of everybody else, but as a mother of 5, concerned 35-year dentist, I've written a little book about xylitol, and if you're interested, I am giving them away to whoever wants one, and if more people want one, I'll send you one. So at the end, come over and power of xylitol to you. So thank you.